Welcome everyone to this issue of innovations in hepatitis elimination. Very pleased today to be speaking with Dr. Michael Odomayo with the University of Medical Sciences in Ondo State, Nigeria, who published a report looking at the prevalence of hepatitis among internally displaced persons in Nigeria. Dr. Odomayo, welcome.
Thank you very much.
Great to see you. Please tell us a little bit about yourself and what kind of work you do in your university in Nigeria, please.
Thank you, sir. I'm Professor Odimayo. I'm by training a microbial pathologist. As a medical doctor, we have been involved in studies in infectious diseases with more interest in hepatitis for some years, maybe since 2007, 2006, 2007, where we started work with getting some prevalence studies of hepatitis B and C in Kano. Then when I was in Benue, Makurdi, we did some studies that showed some of the hepatitis prevalence in Makurdi, and we have had to do screening, community screening, vaccinations, and treatment for so many thousands of patients all through the years. At present in the southwestern part of Nigeria, where we have done some studies in assessing the impact of immunization, the immunization status of vaccinated children in Ekiti State, and we have also done some studies that we are yet to fully publish in Ondo State. The current study is on hepatitis B and C prevalence and some of the factors that we can use to control it among internally displaced persons in Edo State, Nigeria. And this work was done to be able to really see the prevalence of hepatitis B and C, and also some of the things that we can do to be able to control the prevalence of the disease among this special group of people.
Yes, absolutely. And the question about prevention through vaccination is very, very important, as we'll see in a moment from your study results. For people who are not very familiar with Nigeria, please tell us a little bit about the issues of internal displacement, within the country, and why focusing on the health of internally displaced persons is so important.
Yes, we have a lot of issues about internal displacement in Nigeria currently. As we have heard from the national and the international scene, we have had issues of Boko Haram insurgents and so many other various forms of insurgents, herdsmen, Fulani herdsmen, insurgents, and so many other machineries and banditry activity that is going on, conflict between herders and farmers, and this one has led to a lot of death that is making people to run away from their traditional locations, and this has massively and significantly affected people especially from the northeastern part of the country, where you have people fleeing in droves, and especially from even this has become much worse in the last 3, 4, 5 years, where you have so many massive movements across the country as a result of conflict. So even you will discover that early in some year in 2014 or thereabout, you have even in 2018 we have about 142,000 people that were displaced, and in the early part, in the first half of 2019, about 142,000 people were displaced from their various locations, and these things are still ongoing. That you see many young people running from the northeastern part of the country and other parts to the southern parts of the country because of these various conflicts that you are having across the country.
So thank you for that. So please tell us a little bit about the, about the camp where you did your study in Benin City.
Yes, the camp is located in Benin City in Edo State, Nigeria. Is an international Christian center where many people that are fled from their locations, from their state, from their location, were able to find solace. This camp is initially created as a Christian development center, but with this so much of conflict, as a help center initially, but with so much of conflict these days, the International Christian Center now hosts so many internally displaced persons where they are being taken care of, where they are being trained, they're trying to give them succor from the various challenges that they're having, especially that has to do with life-saving challenges. So the camp is a camp where most of them, about 3,000 internally displaced persons, are located as at the time of the study.
And had you done studies in this location before, or was this the first time you had personally been involved in a study in this location?
Yes, this is actually the first time of study in this location, but we have also been there in the course of our preparation for this study. We have been there to see them. We're informed about the camp, and we're there to visit them, to look at the situation in the camp. We saw the way of their life and every other thing. So we've come in to be able to give them some support to be able to give them some encouragement. And in the process of that, we feel that, okay, let's also do this study so that we can be able to support them with some other health indices.
And of course, I'm always very interested as a fellow researcher in how you get the local support, for conducting a research location in a community environment. And so I'm sure you worked with a Christian organization that was operating the camp, but did you have to do any outreach to any leaders within the community or within the camp beyond just those that were responsible for operating the camp to, help them understand the importance of the research and how it was going to operate?
Yes, we interacted with the leadership of the camp, but the support the support that we have for the research is a WHO grant that is given to a Center of Excellence in Reproductive Researches. That is, and that study, we call it CERHI, Center of Excellence in Reproduction and Reproduction. That study, that Center of Excellence had a partnership with University of Medical Sciences. And so the team that we're working with the Center of Excellence from University of Medical Sciences, I coordinate the team, and that is the team that we look at, reproductive health of women. So that was the essence of getting to the camp, because there are a number of women that are there, a number of ladies that are there. So it was on that basis that we got in there to be able to give them some support and to see what we can do about possible issues. So that study is actually into two parts. The first part is looking at externally displaced persons. And these are the people that are displaced as a sort of people going through dangerous journeys to Europe and to other parts of the world, majorly to Europe, that are now being returned. So we're looking at those returnees. Those are externally displaced persons. And then we're also looking at the internally displaced person. These are those people that have to leave the country, have to leave their location as a sort of conflict and all this. So it is this segment of this study that is looking at the internally displaced person that will now go in with into the camp, and we're able to interact with the leadership see some of all those support that we can also give to them. And it's in the course of our other healthcare support to them that we have focused majorly, since our major concern also as a team is also on hepatitis, that we're also going into hepatitis and screening and vaccination, and also referrals and treatment.
Mm-hmm. Was response in those people agreeing to be part of the study? Did they meet your expectations? Were they greater than your expectations or less than your expectations?
Sorry, sir. Can you come again, sir?
Yeah, I mean, how many people said yes when you asked them to take part in the study? How many people said no? You know, was that about what you thought would be that difference, or did you think the camp responded well to participating in the study?
Yes, when we got to the study, we actually went in to be able to look at principally their challenges, their concerns, and the way they are able to survive, because with so large a number of internally displaced persons in a single location, we know they will be having some challenges. So we came in with that mind to be able to support, and we through that also told them that we will want to assess about their hepatitis status, that we want to be able to assess them. And the leadership of the camp were able to understand that these are part of health coverage, because we know they don't have that facility to screen or to treat or to vaccinate against hepatitis. So we're able to explain to the camp leadership, and then to the people. They were really very happy to receive us. We worked together. So many of them even had to participate in some of the questionnaire that were administered. They were explaining to themselves, they'll do some of all those things. They were really with us because we came in and we were actually a great lot of support for an encouragement for them. Yes.
That's great. Well, tell us a little bit about the study. Hopefully many people have read it. I encourage everyone to read it in clinical liver disease. You know, for me, I was very surprised by the average age of the people participating in the study, which appeared to be representing how many young people are in this internally displaced persons camp, and the high prevalence of hepatitis B, among this population. Can you comment on that, please?
Okay, yes. Well, as you know very well that hepatitis B is a major global problem, where we have both hepatitis B and hepatitis C, viral hepatitis in general, they're a major problem. And you know that hepatitis B virus has resulted in over 887,000 deaths as we have been documented, even on annual basis. Even hepatitis C, up to 399,000 deaths that has been reported. And we know that over 247 million people are at risk of premature death as a result of complication of hepatitis B, and about 71 million people are at risk of premature death from hepatitis C. So it's a major problem. And we also know that hepatitis B vaccination is a major solution, because with that, you can be able to prevent cancers and some of the problems that can result in this death. So the hepatitis B vaccination program started in Nigeria in 2004. But up to now, the coverage is still less than 60%, and even much lower in some parts of the country. But we know that the goal of WHO is that that we have to really eliminate hepatitis B problems, and the definition was the fact that we should be able to reduce the incidence of hepatitis B or viral hepatitis by about 90%, and also reduce mortality by 65% by the year 2030. So with this in mind, we have also been working along to be sure we are able to make our own impact in this disease. But we know that with the rate of displacement that we're having within the country, the issue about elimination can become a challenge, because we have over 41 million people that are internally displaced persons across the globe. And in Nigeria alone, about 2 million people that are included among this. So it's going to be a big problem if we don't work on it. And that's why we know that with the rule of the fact that we are looking at the fact that we have to level down on everybody. We have to look at some specific population to be able to work on them. That is in line with health equity for all that we're looking at. And that is our reason for going more specifically into looking at this special population that we have within the country. So our aim of this study is to be able to determine the prevalence of risk factors for viral hepatitis among the IDPs. So we're looking at the prevalence of hepatitis in this special population, and also looking at the risk factors for this, for whatever the prevalence that we may have in that population. So that is why the study was conducted among the IDPs in that special group. And in that camp, about 3,000 IDP were located in that camp. And most of them were between the ages of 15 to 49 years of age. That's where they are. And as we have said earlier on, the camp is located in Edo State, in Benin City, Edo State in Nigeria. We have our ethical approval, and we're able to relate with the leadership of the camp, and also be sure that we had the consent of all the participants that participated in the work. Those of them who were not interested in participating, they were excluded. But of course, most of them, they were really happy to see us, and they really worked with us. So we took their samples. After we have given them the questionnaire that we administer to them, is a semi-structured questionnaire that we administer to them. The sampling technique was random sampling technique, and we did the testing looking for hepatitis B surface antigen using third generation CERHI technique was used for us to do the testing. So we followed the manufacturer instruction for it, and then we did the interpretation as appropriate. So from that study, we found out we're able to screen 346 IDPs that took part in the study. 246 IDPs that took part in that study. And the mean age, as you have noted, is 18.5 years, but they spread between 15 and 49 years, but the mean age was 18.5 years that we have. And about 78% of them, 78.9% of them were female, were female. So that we had. And just about 130 of them, that is 37.8% of them, had up to secondary school level. But of course, it is worthy of note that in that camp, they also have training centers, the primary school setting, the primary school, secondary school setting for the people that are in the ID camp, the camp, that they are able to train them. So we expect that their educational status will improve. So among the 346 IDPs that were tested, 55 of them, which represent 15.9%, were positive for hepatitis B, while 4, which represent 1.1% of them, were positive for hepatitis C. And we also observed that all those that were positive for hepatitis B had no history of hepatitis B vaccination. And we have a total of 285, which represents 82.4% that had no history of infant hepatitis B vaccination. That is in all. But all of those people that were positive for hepatitis B had no vaccination as an infant. So these are the general things that we looked at. And we also know that the groups of subjects that are at higher risk of hepatitis B infection included those who are equal to or older than 19 years of age. These are the people that we have. And another thing we also observe is that from the risk assessment, we discovered that those respondents that had the first sexual intercourse at an age younger than 15 years, either willingly or through rape because of the situation that were around and some other things, they were 2.5 times at higher risk of being positive for hepatitis B that we have been able to see in that study. So these are the general findings that we have. So looking at it, we see that a prevalence of 15.9% among the IDPs is really higher. It's much higher than the average prevalence of hepatitis B in Nigeria. Because in 2016, the average prevalence was 12.5 that was found across the country. So we're having a prevalence of 15.9 among this population, is suggesting that, well, among this special group of people that are displaced, you can actually have a higher prevalence of the disease among them. And this is expected because you see that among this group also, what we also observe is that the age group that we are having here is 18.5 years of age that we're having has been prevalence in this study. And this is the pattern that we see across where you are having displacement, because most of them, their father has died, their mother has been killed in the conflict, they just managed to survive, to run, to be spared. So that is why you have all this thing that is happening. So it's expected you see this thing that is happening among them. Now, the other thing we also observe is that for the hepatitis C, is only 1.1% that we had, and that, so we can see that this we have a prevalence of 1.1%, and this is lower than what we have in other parts, because in some of the studies that were done, we have about 4.7% in Ilorin, we had 11% in Ibadan, but the prevalence we have for the hepatitis C here is lower. But the finding in our study reporting that the male prevalence, which is higher, is also similar to other findings that we had in our various studies. So we conclude from our studies here that the prevalence of hepatitis B viral infection is high among IDPs in Nigeria, and many of these mostly adolescent population.
Very, very concerning findings. What are some of the possibilities of, taking action on that information from your study to actually, help this particular population? Do you see any ways forward in improving prevention?
Yes, part of our effort is the fact that we get back the information to the people at the IDP, and we're able to also vaccinate many of them that were found to be negative for hepatitis B. And we are also making this presentation in conferences and informing as many people as possible who may be able to come to the aid of the IDPs, but not only for the IDP in that location, but getting people to be informed that the internally displaced people across the globe are at higher risk of hepatitis infection, and there is need for a step up to be able to really attain the health equity that we're looking at among this special group of people, so that we can be able to control the disease among them. We have also been able to reach out to government parastatals, to some significant people that may be able to be of support in the control of this disease. We are also using this opportunity to call on the international bodies that this special group of people, we need to pay special attention to them in terms of the control of hepatitis B and hepatitis C infection if the global elimination target will be realized.
Well, that's great to hear how you're seeking to disseminate broadly the results of this study, which really calls for much greater attention on this population for improvements in prevention, testing, care, and treatment. And we, look forward to this report being, in clinical liver disease, being on the Coalition for Global Hepatitis website at globalhep.org, along with this video recording. And we encourage persons who have an interest in this to contact Dr. Odomayo directly. His contact information is on the Coalition website. And we certainly look forward to working with Dr. Odomayo in the future to see how we can act on this research and perhaps extend this type of research into other locations in Nigeria and in other countries. Thank you very much, Michael, for joining us today. Thank you very much for an excellent study. Please keep your attention on hepatitis. We need quality researchers like you to advance progress toward global hepatitis elimination. Thank you again.
Thank you very much. I appreciate your team for the fantastic work that you are doing. You have given us a lot of encouragement, and we are really encouraged. We hope to continue to work with you because we could see your team doing a fantastic job, and we hope to work with you to be able to achieve so much towards the viral hepatitis elimination. Thank you very much.
Thank you again. Thank you.